We are really very happy to receive Balozi and team today in pursuance to our common work on co-creating a new model for primary healthcare, particularly in level 2 and 3, that is dispensaries and health centers. And this is something that we have been working together in terms of, first of all, a feasibility study, where we piloted, as has been said, 3 facilities. And the idea being, we want to try to offer the best health services to the community at those primary levels. And when that happens, subsequently, this will be replicated at all the facilities in the county, and the model will be ready for use in the rest of the country and will also be available even continent-wide. This has been very, very innovative and ambitious work, and the CEO for Health was able to say the results that have been achieved. We believe that when there is good health,
it's not very advanced technology at, let's say, fourth-tier hospitals. In terms of money, we are thinking now of a program of 12 years, in which in total there will be some 25 million euro being passed from our side, if that is being matched also here from local resources. It is all part of the discussion going on, so I cannot give you fixed numbers. But what we agreed this morning is that we're going to wind up this process very, very quickly. And I think already the governor and the chief medical officer said that there was an initial proposal being tabled. There have been a counter proposal coming from Makueni County in a very constructive spirit, and the two are now going to be compared. And one of the things that came out of the meeting this morning was that the county will now come up with a time schedule that will be binding for all parties to come to an agreement and to start implementation. And I think that is high time. We've had the feasibility period, we know the results, we know what we want to achieve. Let's get it done.
And our goal together is really to look at how do we address the needs of the community here in Makueni County. Really looking at universal health care and universal health coverage. How do we ensure that communities are able to access health services affordably? How do we ensure that those health services are of good quality? How do we put investments into the primary health care, where we can talk about health education, we can talk about disease prevention, we can talk about health promotion, and as necessary, we can cure the diseases that are possible at that level or refer these community members up for further treatment. We have been working on a very innovative approach that looks at not just the access to the services in the immediate, not for today, but for the future. How do we make an investment that will return tenfold, 100-fold to this